do, and then we'll take a moment to debrief kind of stuff. Right? Sound good? The first quick introductions. Shiva, I'm an ED physician.
I'm Aaron, I'm a paramedic here in the ED.
For
Prior to
how
that,
many years?
I was a firefighter, paramedic, and SWAT medic for 30 years before I came here.
Yeah, cool.
We're at Portland, Maine.
Okay.
Different protocols.
Logan Smith, paramedic at St. Cloud Fire Rescue. Been there for 6 years now.
Michael Baez, paramedic at St. Cloud. I've been there for 3.5 years now.
Stacy Markwith, Osceola County Fire Rescue. I'm an EMS training lieutenant. I've been with the department for 23 years.
Cool. Thank you, Seth. Okay.
Anna Partner, I'm a nurse, full-time simulation center.
Josh Savino, paramedic for Orange County. I've been there for almost 9 years now.
Cool. Wonderful.
Okay.
Lindsay, so that you're not just
Videographer first day. Education specialist.
Cool. Awesome. So, like I said, we'll let you know what to expect here, and then we'll set the EMS dispatch. Anna, help us. What can we expect here?
So what you can expect from your mannequin, while this mannequin is high fidelity, it can't do everything, and we're not here to trick you. There are no tricks in this. So as you're doing your assessment, just verbalize what you're seeing, hearing, feeling, and we can help guide you in the right way. But he does have radial pulses, he does have carotid pulses, chest rise, and lung sounds. So if you're assessing, just make sure that you're feeling and listening. If you use any sharps on our mannequin, which hint, hint you will, please make sure they get disposed in the sharps container here. Any supplies that you might need are going to be found on the counter back here. If you are looking for something that you don't see, hi, welcome.
Welcome.
We have magical fairies.
There's no tricks, so just because you don't see it doesn't mean that it's not something that you might use for this scenario. Please just assume that this mannequin, you can do anything with this mannequin that you could to a real patient. I will stop you before you do anything that might hurt the mannequin, but other than that, I give you permission to go ahead and do any intervention you feel necessary for the child.
Awesome.
Any questions about the mannequin? The voice of this child is going to sound a lot like Dr. Kaladindi. So if you're asking him questions, it might sound like Dr. Kaladindi. It's not, though.
Yeah. With an Indian accent, obviously.
Said it on the wrong syllable.
Yeah, syllable. Quick introduction, right?
Yeah.
Okay. All right. Wonderful. So you'll be working at the scene. So what would happen right now is Aaron will provide the dispatch call, and what I want you to do after the dispatch call is take 30 seconds to a minute to think of what you would get prepared as you arrive to the scene. And then when you are ready and when you arrive to the scene, the case would begin. Yeah? Okay? All right.
All right, you are dispatched to a very busy city street for a roughly 10-year-old boy on a scooter struck by a car. Caller reports there's blood everywhere. That's all you get.
All right. What team is going there? It's how many people would be going there?
To the call,
Yeah. Five.
at least 5.
All right. You got the 5 of you. So what are you guys getting ready for as you're going to the scene?
So I'm always in the pool, my hands heavy up,
Okay.
just to kind of, my baseball signs, their weight, because a lot of our doses.
How far is my
weight-based.
pediatric trauma center?
About 15 minutes.
Maybe
Regardless, it can stand by at the very least.
Okay. Protocols open. Okay.
They say Orlando's an hour away from Orlando.
Absolutely true. You're not wrong.
All right. So you're ready to get to the scene? Okay.
All right, now you're here. This is what you see.
Copious blood. It's everywhere.
You're standing in blood now. It's everywhere.
First thing we're gonna do is assess the bleeding, we're gonna fix that first.
Sample pulse.
Go ahead, take a look. Yeah? No, don't worry. You tell me what equipment, I'll keep providing this.
Okay. So he has a pulse, he's breathing right. But regardless, we've got some life-threatening bleeding.
What's going on? Yeah.
Does this,
What do you need?
Does this look like arterial bleeding?
Yeah, go ahead.
2-person job here.
We need to expose them to see, look for,
Is the bleeding life-threatening?
Yeah, there's
Copious.
the copious spurting blood.
Okay.
Tourniquet, all right, we'll get you a tourniquet. Here's a tourniquet.
Sorry buddy, this is gonna hurt.
You said his breathing is fine, is he responding to any questions at all?
He is in a lot of pain.
Does he have
Uh,
chest rise?
the breathing, nobody, you can listen to his breath sounds.
Okay. Adequate chest rise and
Did he
fall?
just go
Uh,
unresponsive?
You'll see it.
Yeah,
He
you'll
is
see
trying to
it.
go responsive
All
right
right.
now.
Okay.
You didn't unplug it, did you? You didn't unplug
His
it.
mouth is blowing?
I restarted him.
Okay.
That's it.
Yeah,
I'm not seeing any chest rise
You have
or
chest
fall.
rise on the right side.
but no chest rise on the left.
None on the
Okay.
left.
We need to
Gonna
decompress.
decompress.
What do you need?
Can we get a OPA and a BVM?
Did
Yeah,
anybody listen to the
we get a
breath?
BVM.
Yeah, that's what it
Yeah.
is. Just gave us long sound. Said.
All right, what do you need to decompress? Oh,
Uh,
he's breathing though.
Okay.
He's breathing, it's just that there's absent breath sign sounds on the left.
Okay. Alright.
What do
We're
you-
gonna wanna decompress.
Okay.
In the second intercostal space,
Get
over the
backboard
third.
ready.
Get the backboard,
Okay,
so you can
backboard
roll.
is ready.
Yeah. Oh, he's blinking, looking around.
Do I have a stethoscope? Okay.
Is there family around or anything that we can get
Yeah.
information?
Let's
Nope.
say the needle is
No.
in.
His 5-year-old little brother's gonna call
That's like
911.
what we're providing.
Okay.
So it's
Decompress.
decompressed, are we having any
Reassessment
changes,
sounds.
reassessing in there?
Any blood or air coming out after we decompress?
Yes, there was a whoosh of air that came out.
Okay, did we, lose distal, our pulses when we?
Yeah.
We did?
Yes.
Okay, we put our time when this was put on as well.
The time has been placed.
Sounds.
Okay. So lung sounds improved,
Yes.
Lung sounds have improved.
okay, responsiveness changed at all?
He says he is breathing much better right now.
He's bleeding quite a bit, I wanna be peeing fairly fast.
Does he have a radio?
Does he have a radio?
Your blood
No.
pressure.
He's
He
he's
does
on
have
the
a-
monitor, it's up on the wall behind you.
Oh.
Your blood pressure is 72 over 40.
Oh, he
I'll
does.
get an idea.
Yeah.
Are pupils
Yeah.
equal?
Oh, you're
Yeah,
fucking
pupils are equal and
fine.
reactive.
Pupils are equal reactive
We
to
have
light.
an IV set up.
Yeah, I'll get you an IV set
You
up.
Or
can
an
start an
IO.
IV in the right.
You can go ahead with the IO.
Okay.
I can start it here.
Yeah, or an IO.
Airway is still like clear and.
Airways clear, everything's passed. You
You
can just verbalize.
Do you have a respirator?
Your IO is in,
IO
fastest
is in.
IO ever.
Distal femur.
Respiratory rate is 50.
Respiratory rate is 50.
Okay.
You
Given
think he's
the amount
scared?
of
You
blood
think it
he's
hurts?
lost,
Yeah.
the
Is
bleeding's
anything
controlled, I'm gonna wanna probably
coming out of his
pull
mouth?
some fluids in. At
How much
least
fluid?
he is 1032 kilograms, I'd say at 200 for
Okay.
now, 200.
All right, 200 ml of normal saline going.
Yeah, just be a syringe bolus to get that on board fairly quick, and
Okay.
then,
So I know for Orange County, we have blood, I get the blood cap in there.
Yeah.
That's good.
yeah,
The
we'll
blood
do all
captain
that.
came with the blood.
Oh, perfect.
Do you wanna maybe think about transport now that we got it
Yeah.
stabilized?
Get him on the backboard.
Right.
Check out his back.
Good call.
On the roll on this side, and get on this side.
Yeah.
Does pelvis feel intact?
Yes, his pelvis is intact.
So we haven't exposed him yet, ideally we would have already done that, since we
Yeah.
were doing other things and other interventions. When we did expose him, were there any other
No other
injury?
no other bleeding that
No
we see in the
crepitus,
front.
nothing like that,
crepitus,
no, besides this obvious open fracture, we're not
Yeah.
dealing with anything like that, right?
All right, on your count.
Alright, 1, 2, 3, we'll check his back and then have somebody do.
Yeah.
No step down or anything like that?
No step down that we feel.
And 1, 2, 3, down. Down.
Just, ready?
1, 2, 3, down. And then back up. 1, 2, 3.
You don't need to strap him.
All right, as we are getting there, so far what has been done is the chest has been needled. Patient is breathing on his own.
He is a trauma alert.
He's a trauma alert. Tourniquet is in place, which is being timed, and blood is being administered to him. And you're ready to transport.
At least where I'm at, I probably would have landed air care for this patient. I'm not gonna ground and pound all the way to, Arnold Palmer.
Let's
Say
go.
15
Especially
minutes
because
from
we
where
don't
we're
have
at.
Yeah.
blood and air care can provide it.
Yeah.
Oh, okay.
Even something just like that.
Given that we did also we did intervene to an extent with his ventilations, given the decompression. He's probably gonna need a chest tube fairly quick. I believe Eric has the ability to do something along those lines.
Okay. All right. So while that is being planned, are you ready to give report to the hospital? All right. All ears. Go
How old
ahead.
is the patient?
10.
Okay, how fast was the vehicle traveling? Do we know?
No.
Was there anyone on scene that took any information like that? Unknown? Okay. And and there was no LOC reported at any
No
point.
reported.
If you
People
remember,
sequel reacted.
if you remember what happened,
His people's actually respond.
Oh, they do?
does he remember what happened at all?
You guys
Remember?
got
He's just in a
high-tech
lot of
stuff.
pain.
He's in a lot of pain, so he didn't respond to that.
Oh, yeah, oh my God.
So he's a 10-year-old, so rescue 32 inbound
That's
RMC with a trauma alert. How do you copy?
That's freaking crazy.
Rescue 32 is inbound on your facility with a 10-10-year-old male.
That's what I
Chief
said.
complaint is going
Just
to
a
be
AAA driver.
a
My assessor's lung sounds again.
Yeah, go ahead.
That's a good point, you're gonna do that continuously.
patient was traveling on a scooter when he was struck by a vehicle. Unknown speed of the vehicle. Unknown if there was any LOC reported. Patient has an open fracture to the tibia. He has been decompressed and his C-spine precautions have been taken. He's also received fluids and whole blood. Initial vitals on scene were initial hypotension, some absent lung sounds on the left side, prompting the decompression. All of the vitals are within normal limits and he's responding appropriately. His blood pressure has been assessed post-blood and post-fluids and it has improved significantly. No other outward signs of injury upon trauma assessment. Do you require anything further?
No, with our team, we'll see you when you get here, so